How are you?
I'm doing well.
Are you ready for your 73 questions?
I think so.
All right, well, for those who don't know you, what is your name?
My name is Dr. Brett Cerniglia.
What is your specialty?
My specialty is diagnostic radiology, specifically musculoskeletal radiology.
For those who are unfamiliar with this term, what does a radiologist actually do?
So a radiologist uses diagnostic imaging in exactly that, diagnosing pathology within patients.
How many years have you been practicing?
I've been in practice for 4 years.
Where did you go for your undergraduate degree?
For my undergraduate degree, I went to Massachusetts College of Pharmacy in Boston.
What medical school did you attend?
I attended Albany Medical College up in upstate New York.
Did you take any gap years before going to medical school?
I did. I took 2 years off in between. The first year I spent working at a mental health hospital, and the second year I received a master's in public health.
What was your favorite part of medical school?
My favorite part of medical school was just the learning. You know, it was the one time in my life where I could just sit there and my only purpose was to focus and learn about medicine.
What was your least favorite part about medical school?
My least favorite part about medical school were the long hours just locked in a room studying.
What specialty did you think you were going to choose when you entered medical school?
I was debating between a couple specialties. I think, orthopedic surgery was on my mind, and radiology oddly was always sort of a focus, and I think musculoskeletal radiology sort of fit that dynamic well for me.
Was going to medical school always a goal of yours?
It was in my head for a while. I started in pharmacy school, and I think during my journey there, I started to realize that it was more of a reality for me. It was something I sort of thought about for a while.
For those interested in musculoskeletal radiology, how many years of school do you need after medical school?
So after medical school, you need to do an intern year of just general medicine, 4 years of diagnostic radiology, and then an additional year subspecializing in musculoskeletal radiology.
How does it feel to be a part of Atlantic Medical Imaging?
My experience here has been great so far. My early career has been awesome, and I couldn't imagine myself anywhere else.
What would you say is the most unique part of your specialty?
I think the one thing that sets this specialty apart compared to others in diagnostic radiology is sort of the level of detective work you need to do. When a patient experiences an injury, trying to figure out what that mechanism was that caused the injury, and better understanding patterns of, for example, ligament disruption in a knee injury. You can really get a good sense of what actually happened to the patient based on the imaging alone.
Why should medical students choose your specialty?
I think people interested in sports in general should choose this specialty. It gives you a lot of exposure and sort of insight into, the struggles of athletes and different injuries that may occur in various disciplines of sports.
What are the stereotypes about your specialty?
A lot of people think of a radiologist, they think of someone that just sort of hides in a dark room. Oftentimes clinicians will come in and just sort of be overwhelmed by the darkness, and I think it's a lot more than that, and we actually have a lot more interaction with clinicians and patients than people might realize.
How many patients do you see in a day?
So in terms of overall cases, I'm reading 50, 60 cases, so those are all separate patient encounters. We actually do a lot of different procedures on patients throughout the day, ranging from like 5 or 10, depending on the day, where you're getting to interact directly with people and oftentimes doing injections, helping people with their pain. So it's a lot of variety that we see.
What is the most number of patients you've seen in a day?
In certain shifts, depending on the type of modality I'm reading, you can see hundreds of patients in a day.
How many studies do you see in a day?
Yeah, same kind of thing. So, if I'm reading a busy hospital shift, you can get upwards of 200 studies.
What is your favorite part of your job?
The favorite part of my job, making a difference in people's lives. And I think a lot of that honestly comes from those situations where a patient comes in with joint pain and I can inject a therapeutic into the joint and just see right away that they have relief. I think it's exciting to help people who've otherwise been struggling.
How many hours do you work in a day?
It amounts to be about a 9 to 5 sort of situation. We still take weekend call and some evening call, but on average, it's about that.
What time do you wake up?
I wake up at 5 every morning, so I tend to like to get in some exercise before my day.
What time did you wake up today?
I woke up at 5 today. With a little kid, it's just like there's only a certain time where I can actually have to myself and exercise, so it tends to come, at the early hours.
What is one of the most common questions your patients ask you?
I think oftentimes when I'm doing a procedure, patients come in with joint pain. They'll often ask me, how long is this going to work for? And it's totally variable depending on the patient. Everyone sort of reacts to the medication differently. I try to give them hope without them being overly optimistic about the results.
What is one of the least common questions your patients ask you?
I can't think of anything. Let's skip it.
Do you work more at night or during the day?
During the day.
What is a unique medical fact that you will never forget?
What's a unique medical fact I'll never forget? Okay, I have a good one. So oftentimes patients come in with calcific tendonitis and, they get so focused on the calcium that's deposited in their shoulder. But what's interesting is the pain isn't necessarily coming from the calcium, but rather inflammation of this bursal space around their shoulder. And I try to explain that to them and sort of the purpose of the procedure to help them better understand what's actually generating the pain that they're feeling.
All right. How long does it take you to chart?
I don't chart.
What is the most common medical advice you would give your patients?
One piece of medical advice I like to give people, especially when they're coming with back pain, it's sort of counterintuitive. A lot of people have back pain and they feel like they need to rest in bed, but that actually makes it worse. You got to get out there as best you can, stay active, keep loose, and I think it's something not a lot of people are aware of.
What is your favorite medical fact?
I can't really think of one.
All right. Did anything surprise you about your specialty once you started working in the radiology field?
I think so. I think really the amount of patient interaction that I would have, I think really just that perception of radiologists sort of hiding away is not realistic.
Well, we've talked about you professionally. Let's talk about you personally.
Oh, God.
What is your favorite thing to do when you're not working?
Well, when I'm not working, I think exercising.
Do your family members ask you random medical questions?
Oh, yeah.
What is your favorite animal? Not a cat or a dog.
Tasmanian devil.
What is your favorite color?
I've thought about this for a while. It's sort of changed over time, but I think a type of blue is my favorite.
What is your favorite purchase?
My favorite purchase? I have a nice bottle of whiskey that I'm pretty proud of.
What is your least favorite purchase?
My least favorite purchase was probably that mountain of student debt that I have.
What is your favorite hobby?
My favorite hobby right now is surfing.
Do you collect anything?
I have a pretty nice whiskey collection.
If you could have dinner with anyone, past or present, who would it be?
Man, there's a list. Probably alive, Neil deGrasse Tyson.
Which meal would be served?
All right, my favorite dish, restaurant Cafe 2025. They do this twin lobster tail fra diavolo. Super good.
Coffee, tea, soda, or water?
Coffee.
What is your favorite lunch to have while working?
I keep it simple at work. I tend to have like power bars and salads.
Pineapple on pizza? Yes or no?
Nah.
What is your favorite meal to eat?
Favorite meal? I think pizza's a good one.
What are your top 3 places to travel?
Okay, so the Amalfi Coast is number 1. It's just like heaven to me. Recently went to Greece. That was awesome. Outside of that, I have some family in Florida, and my daughter loves Disney, so going to Disney World.
What is one place you're currently wanting to travel to?
I have a vacation to Spain teed up, so pretty looking forward to that right now.
What is your dream career?
Probably what I do, honestly.
How do you relax after a work day?
So I like to go home, say hi to my family, and sit down with my wife and have a glass of wine.
Do you prefer nights in or nights out?
I like having nights in.
Beach or lake?
Beach.
Favorite month of the year?
Would definitely be a summer month. Probably July.
Hot weather or cold weather?
Hot weather.
Favorite sport to watch?
Football.
Walking or running?
Running.
Are you an introvert or an extrovert?
Introvert.
Is this why you chose your specialty?
It's part of it.
Can you share a fun fact about yourself?
What's a fun fact about me? Okay. I got one. All right. So I got pretty into coffee, and to the point where I have a pretty extensive setup at home where I make pour over coffees, and pretty awesome.
Sounds good to me. What did you want to be when you were a kid?
An astronaut?
Is there a different specialty you think you would have done?
No.
If you didn't go into medicine, what other careers do you think you would have pursued?
Probably something else in the sciences. I like astrophysics.
If you could have one superpower for 24 hours, what would it be?
Time travel.
Would you change anything about your journey through medical school?
I don't think so. I think, ultimately looking back and where I am now, I think everything worked out great.
What is one piece of advice that someone gave you that has stayed with you?
I think just perseverance in general. There's a lot that goes into training as much as we do, sort of putting life on hold for the career, and just trying to keep that mindset, keep the focus, something I always think about.
If you could change one thing about the medical field, what would it be?
Less bureaucracy. Field itself is super fragmented, some for the better, some for the worse, but I think there's probably a smoother, more efficient way to run things.
What can potential medical students do now to prepare for your specialty?
I think getting exposure early, deciding what career you want to go into is super difficult, and you don't want to make the wrong choice because it's the rest of your life essentially. It's harder to jump around after. So getting exposure to a lot of things early on and making the decision that's right for you.
What advice would you give to an aspiring medical radiologist?
Work hard, and I think similarly, just make sure it's the right field for you before you go down that road and make all the commitments that you're making to become one. Yeah.
And lastly, what would you say to your current and future patients?
I would say the future of medicine is bright. Here at AMI specifically, we're incorporating a ton of new fun and exciting things that just help better improve your health as a whole, and I think there's a lot to look forward to. I'm Dr. Brett Cerniglia. Thank you for watching, and if you have further questions, feel free to reach out to our website, aminj.com.